Greetings from Washington, D.C. This is Peter Thomas, the General Counsel of NAAOP, and I'm here with the two NAAOP Summer Fellows, Alicia Carver and Susanna Egdahl. It's the last day of the fellowship, and we wanted to make sure that both Alicia and Susanna had an opportunity to report on some of the key moments and some of the work product that they've produced during this very productive summer. Then I plan on coming back and reporting on a new proposed regulation involving prosthetics, orthotics, and durable medical equipment. Alicia?
Hi everyone. This summer has been so great. We have gotten a wonderful education in health policy and advocacy. The primary project that I have worked on this summer with helping with AOPA and the O&P Alliance was taking meetings on Capitol Hill to help inform legislators and their staff about the Medicare O&P Patient-Centered Care Act. We completed 36 meetings this summer with members of the Ways and Means, Energy and Commerce, and Finance committees. Everyone gave us a great reception and seemed to give us a great intent to help find out more information, and looking forward to reading the bill when it comes out of Legislative Council. We also had a great meeting with Senator Grassley's staff, who really helped us learn a little bit more about what Congress is thinking and how the bills can help move forward in the committees.
And Susanna?
So in addition to accompanying Alicia on all these visits to Capitol Hill, my other project was to work on compiling a set of evidence-based statements supporting the value of orthotics and prosthetics care. This involved a lot of time reading through the JPO as well as other academic literature. I hope that what I've put together can serve as a good starting point for anyone who's looking for bullet point statements to take to legislators and policymakers that scientifically support the value of orthotics and prosthetics care. And just to reiterate what Alicia said, this has been a fantastic summer experience, and I've learned a lot from it. So thank you to everyone who helped make this experience possible.
Well, we're going to miss the two fellows, especially now because the proposed rule just came out yesterday on the durable medical equipment, prosthetics, orthotics, and supplies benefit. And normally this rule, which is published each summer, normally doesn't really impact orthotics and prosthetics all that much. It focuses on DME. But this year is different. We have a 60-day comment period. Comments are due at the end of September. And we're going to have to comment. NAAOP will clearly comment, and I expect the O&P Alliance will as well. The rule raises some very alarming issues for the O&P community. First, it really treats a lot of orthotics and prosthetics policy in the same manner as it treats durable medical equipment. And this is no surprise. CMS has, for quite some time, typically tried to stick a square peg into a round hole with respect to O&P policy, and they're doing it again in this rule. It makes the O&P Patient-Centered Care Act that much more important because there's a provision in that bill that would explicitly separate orthotics and prosthetics from durable medical equipment and have CMS regulate those two very distinct fields in different ways. The bill makes major changes to the gap filling process. That is a process that CMS uses to assign reimbursement levels to new technologies that are granted new L codes. We fear that there is going to be a real drag on investment in research and development in the O&P space if the gap filling provisions as written are allowed to go into effect. The bill also would consolidate what they call the master list that currently contains 82 L codes and a bunch of DME codes subject to prior authorization. Not only do they add another 144 L codes to that list of prior authorization, which allows CMS to select any one of those codes and subject them to prior authorization. But they're also talking about including in that master list the face-to-face physician requirements as well as written order requirements that apply to durable medical equipment. And so they're mixing and matching O&P and DME in a way that we really do not support. So those are provisions that we're going to have to look long and hard and decide how we approach them, but ultimately we expect that we're going to raise some serious objections to the new proposed rule on DMEPOS. we'll keep you in touch with that, and we look forward to seeing you at the upcoming national meeting in the open meeting in San Diego. And thanks so much for your support of the OMP Fellowship. It's been an incredible summer. We look forward to our next class of fellows. Thanks so much.